This is Chapter 3, Self-Directed Application for Family Managed Home Care. So far you've seen the medical accomplishments, stopping, stabilizing Grace's vascular dementia, reversing her diabetic retinopathy. She's got a heart like 2015, right? And you've seen her wishes. She wants somebody who will get the family managed home care. It was originally to help her son, but I haven't been paid in 4 years. It'd be nice maybe to get it for me and to get it going forward for whoever she needs, and so to set the example for other people, and to do it, like we said, with the model of the Center for Independent Living, and have seniors helping seniors, right? Overseeing the money and all that. And save anyway. So here we have the form. Here we have the form. This isn't actually the form. This is talking about what is family managed home care, right? And that's where you get money to pay, just like the people in the Center for Independent Living. And you become a client as opposed to a patient, sort of. So who is eligible for family managed home care? Patients in extraordinary circumstances. Who are patients in extraordinary circumstances? Unique scheduling issues. That's all you really need to know, but the frequency as well, right? So they cannot, home care only does scheduled visits. And so Grace is in the middle of that, and a nursing home which is 24/7. She's in the middle. So if she stays in her home or with a family or another lady, or maybe stays in her own condo if she was a little better and somebody in the building looking after her, like in the assisted living formula there, they could meet the unique scheduling, right? The unscheduled, the emergency, just staying in touch actually with their metabolism and their glucose level. So they eat between 6 and 8 and they max out between 10 and 12. But they do need help with that. And that's why Grace is entitled, because of her unique scheduling issues, right? And they're failing her, and they know that. And this is the only way it can be fixed, with one-on-one care. And then who can the patient or substitute decision maker hire to provide family managed home care? The patient or substitute decision maker may purchase services from a service provider agency, an independent contractor, or an individual. What's important here is that all providers hired must be at least 18 years old, be in good standing with a regulatory college in the case of a professional service, because it doesn't have to be a professional service. Maintain the required amount of liability and abuse liability insurance. Of course, you got to have insurance, right? Have a valid CPR course. I took one, that's 2 hours. I've got lots of coaching courses and trainers courses. And be capable of providing the service. So obviously, the alternative being the nursing home is not working. So obviously, we need to try something else. And this has worked in this case. So, and we should be expanding this project actually. And pass a police vulnerable sector check. I've had so many of those checks done. I've coached 1,000 kids. I've been great. I'm very, very, very grateful for the people that let me spend time with the kids, and I'm just as grateful, maybe more so, for the children themselves. What a blessing, man. What a blessing. So that's what's important. And here is the application for Grace Kwok. I filled it out, right? Said she cannot direct her own care, right? So I would be directing it as per the powers of attorney. And here's patients in extraordinary circumstances, remember? So she basically gets nursing services because she gets the drugs and everything dealt with, and she has her occupational therapy services. I helped her with her sciatica so she can walk with a cane and a walker and everything, right? Her lights were all unshaded and glaring in her eyes. Her TV, her laptop, everything was glaring in her eyes. I had to tone everything down, take some bulbs out, things like that. Dietetics, of course. This is all about metabolism, and it's all about what you put in your body. So Grace eats a very healthy, keto-friendly diet. Lots of vegetables, greens, fruits. She just eats a wonderful diet, actually, but it's expensive because her socioeconomic level of her life, she demands quality food. And social work services, yeah, I guess so. We've been under a lot of duress for 4 years. You know, personal support services like cooking the meals or doing the grocery shopping or paying the bills, all of those, you'll see them all in a few minutes in the Patient Bill of Rights. And homemaking services, I guess under there you would say that I do all the repairs, right? I've done a lot of repairs, replacing faucets, replacing mixing valves. Our condo's 25 years old, so things are starting to fail, right? There was a leak upstairs, came down through. They wouldn't let me do the work. They sent contractors that drove me crazy. I had to make sure that they insulated. They hooked up her hot to her cold, and her cold to her hot on the water to her washer, and left her for the weekend. If she would have done her laundry, she would have ruined. She has so many she has amazing clothing. Anyway, so sort of like that. And then medical conditions, diabetes, insulin use, and memory loss. And then within the last year, has your need for assistance requested above changed? Yes and no. There is improvement in the diabetes and insulin use. In other words, she was getting better as per the 2-year multi-domain approach or the Finnish geriatric approach. Or they know they can get better, but she still wasn't well enough to be left alone. Live alone, but she lives with me, right? And then hire an independent contractor. It could have been me. It turned out after a while that I thought, hey, this isn't a bad career move with my bad back and bad heart and blah, blah, blah. But I do need to train somebody because, there's a very good chance I'll die before Grace. And also, I'd rather hire somebody so I can go to work a little bit and make more money, right? Or work on our books or work on different things, because it would just be better than two of us together 24/7 every day as well, right? And we could follow, like I said, the similar format to the Center for Independent Living Toronto. They pay up to 212, 7 hours a day, 7 days a week, 212 hours a month. And they were averaging in 2017 a little over $4,000 a month. So, and that's average, right? So, management requirements, right? Recruit, verify credentials, and hire an independent contractor. I can do that. I've been hiring contractors my whole life. I'm a licensed contractor. Review police vulnerable safety check, done it many times. I've been coaching kids for 25 years. I've coached 1,000 kids in soccer and hockey. And then for employee payroll deductions, not applicable because this is the responsibility of the independent contractor. And this is part of the reason we wanted the public guardian and trustee to take control. And if somebody took the time to look at the decision, they would see that part of the deciding factors was the fact that we wanted the public guardian and trustee to have it because we wanted oversight. We didn't know in the beginning that there was a formula or a financial form 2 to fill out and an application to take guardianship. Nobody told us that. It does exist, and we've since done that. So then when you go down a little further, right, very, very simple, right? Vulnerable sector check, independent contractor pays her own taxes. That's the best way. So that way, if she signs over her pension, it's 100% deductible for her. And then everything I buy her, including all her high quality food and her supplements and everything, is all tax deductible because she's coming to me for the service, right? And even my vehicle would be percentage, right? Everything. I can pay off right off the gas, all that properly and look after it. And the independent contractor must pay WSIB premiums where applicable. I do have a WSIB account for my contracting business. It turned out I never actually used it in the end, but I still have it and there's still a balance there. Pay both the employee and employer portions of CPP contributions. Easy enough to do. Been doing business taxes since 1989. at least $2 million liability insurance. Let's organize a contract. Give me some money so I can pay for the insurance, and I will have it ASAP. And then, so it's just insurance coverages, right? And as an independent contractor, and you don't need any training or anything. It says, in a space below or on a separate page, please describe any strengths, experience, and/or training that demonstrates your ability to be self-family manager of healthcare services. I've been managing the care of Grace Kwok for almost 2 years. It's been 4 years now, almost, right? And please see attached doctor's letters, which you'll see coming up soon, probably, in the medical correspondence. But you've seen some already, including the letter to go along with this application, right? And I had a Facebook page with another phone since I changed phones. I hope you can find it because it's got so many beautiful things on it. Beautiful. And you see a lot of great food. You'll see why Grace's care is her socioeconomic. She's expensive. And I'm the power of attorney for personal care. Now there is something in a letter from the hospital or somebody saying that I have a paper, but it's not the right one. Well, they're not the judge of that, and it is the right one. And you've already seen where the Public Guardian Trustee's office is trying to say I surrendered it. No, I've been asking for it back for many months because I know they don't have enough money to pay me, even if they liquidated everything Grace has. So that's not the point. The point is I want to be in charge of looking after her exactly how she requested, and I want to look after her wishes. I want to make sure she's cared for the way she wanted to be cared for, and that can be done even minimally with her pension. Never mind her other money that she has, or the equity in her condo, or her bond account, or her RIF, right? And she does owe money too, but there's lots there. Anyway, God bless her. She knew all about this stuff, and I'm not sure why other people didn't. Thank you very much. Chapter 3.